with the current pandemic, I'm a nurse. Our audience is limited. That is my 4-year-old son and the dog. So that is what we're working with today. A lot of people are quarantined at my job, so I don't feel comfortable being around a bunch of people. So excuse my panned audience. It may be a little noisy, and my subject is probably not really interesting to him. My name is Jordan Kraft, and I'm going to be talking about postpartum depression. Most women think they are going to be so happy after they have a baby, but then the reality sets in. They realize that it's super stressful. They feel like they're pretty overwhelmed. There's a lot of anxiety with having a new child. Even though we've played with baby dolls and we got super excited and wanted to have a baby, I guess we don't realize how much work is behind it. And according to the IDPH, 20% of women suffer from a disorder that's called postpartum depression. Postpartum depression is an illness that is affecting mothers every day, and the numbers keep rising. Do you know anyone that's possibly expecting a child? Possibly a sister, a friend, your spouse? It's important that you understand the signs and symptoms of postpartum depression, and maybe that you could help diagnose someone, help save their lives, or just be a lending ear. As an OB nurse, I've seen firsthand the damage of postpartum depression and what it can do. We're just going to go over a few slides here. Symptoms of postpartum depression are anxiety, sadness, anger, exhaustion, sleep deprived. I don't know if you can see that very well. This illness is fatal if not treated. It can be. If the mother can't get out of the depression herself and it's not treated, it can be very traumatic, and they can end up committing suicide. They call postpartum depression the silent killer. The illness is awful. It's supposed to be an exciting time in the mother's life, but because of the depression, it's very debilitating. They don't understand why they're not happy. There's no really diagnosis for this illness. They don't understand why they have everything and they're still not happy. The embarrassment that they feel embarrassed because they should be happy, and they have it all. A lot of moms do that have postpartum depression. And some moms don't have very much, but they are still dealing with it, but they're embarrassed. It is really important that we have them get diagnosed and get treated, because that could save a life. Let's learn a little bit about postpartum depression and how it affects the mother. What is postpartum depression? How does it affect them? First, you need to know that postpartum depression is debilitating. Some of you have heard about the baby blues, but this is different. Baby blues is, oh my gosh, I'm anxious, I feel overwhelmed, I'm trying to breastfeed, and those are all normal feelings, and they kind of subside. Postpartum depression is very different because the feelings never subside. It's like a black cloud is all over them all the time. They feel constantly overwhelmed. They can't even get out of bed. They just cannot deal with being a new mom. A new mom that has postpartum depression will normally withdraw herself. So she will withdraw herself from the child, withdraw herself from her husband, or withdraw herself from her mother or friends. They feel really embarrassed, so they try to hide all of their feelings. And they try to hide their illness, and they just don't want to talk to anyone. So that's why they're not talking to anyone, so they can hide it. The illness is a silent killer because they feel like there's no end to the illness. They feel like they can't get help because they're embarrassed, and they feel like that they can't get out because there's no end to the depression. it doesn't discriminate against anyone. Even famous mothers like Cardi B have explained in People's Magazine, and when she was touring with Bruno Mars, that she reportedly began feeling better a few months later after being treated from postpartum depression, but it's something that she has dealt with. I'm not sure if you guys know who Cardi B is, but she is a famous superstar, and there's a little video there that I can include that you guys can watch my slideshow of, that she just explains that postpartum depression is something that she had dealt with, and it doesn't discriminate no matter how much money you have or what you're going through. It doesn't discriminate. The reasons that it's important to look for signs and symptoms of postpartum depression are a lot of women feel like that they are embarrassed, that they're not worthy enough to be a mom. They're feeling that there's no way out of their situation other than death. Data suggests that the rate of of death by suicide is about 5.3 to 6.5%. That's about the death that they state in Style by Cassie Shortsleeve. She states that that's about the rate of deaths committed suicide due to postpartum depression. A lot of the times the mother won't come out and express her feelings, so it's important that we look for it and act on it whenever we see a mother that's struggling. You may just even lend a helping hand by just listening or holding her baby and just giving her a second to get her feelings out. Though this is a terrible disease, whenever women do seek treatment, they will fully recover. It feels like it's debilitating and they can't get help, but medicine has advanced over the years, and as a nurse, an OB nurse, we have come leaps and bounds, and we are more prepared for mental health and the mother's mental health. We give a postpartum depression screening, and what this does is it's just questions that we ask them. If they get a certain score, then they will then let the physician know that this is a flag that they may be battling with some issues with postpartum depression or some symptoms of postpartum depression. As an OB nurse, I have opened up with patients with my own battle of postpartum depression and knowing how they feel. So a lot of times that's how I get my patients to open up. I ask mothers several times during the visits how they're feeling, if they're frustrated with breastfeeding, and this just helps them digest their feelings or get their feelings out there at their physician's office. Cheryl Beck, in State of Postpartum Depression Screening Scale of Development and Psychiatric Testing, she said that approximately 400,000 mothers in the United States experience postpartum depression each year. However, only a small portion of those are actually considered depressed. The screening is put in place to help diagnose postpartum depression. A score over a certain number, like I said, is a flag for the physician to open. It's a door to open up so they feel more comfortable talking about it. A doctor will actually need to speak with the patient and actually diagnose the patient with postpartum depression before we can move on with treating the patient. And with that way of treating the postpartum depression so they can recover, they normally need to go to therapy, or they can also choose to go to, or they can also get some medication. A lot of physicians would like for them to do those together, so therapy and medication together. And those can help with a lot of their issues like anxiety and sleep, and help monitor a lot of those issues as well. It is very important to monitor those patients and keep a close eye on those patients. They should be coming in for routine visits until they are completely healed. Postpartum depression is an illness. It is a real thing, and we just need to be more aware of it as a society. Postpartum depression can be identified in early stages. Like I said, if the public is more aware of it and more educated on it, it's best that we go ahead and let them know, hey, you're just not acting yourself. Would you like to talk about it? Postpartum depression is the leading killer in new mothers. We should be more aware of that, and we should be able to speak out about it and let them know we see you and we know that you're not acting yourself. Even though postpartum depression is terrible, there is treatment with therapy and medication, and they can fully recover and be awesome mothers. They don't have to live like that the rest of their lives. We know that having a baby is so exciting. Everyone's excited about it. The whole family gets excited. But with the stress of having a new baby and the hormonal changes, many people suffer from postpartum depression. From my personal experience and as an OB nurse, it lays super heavy on my heart to speak about postpartum depression. This illness should not be taken lightly. Just last week, I spoke with a new mother, and she has a 4-month-old baby that she loves very much. But this illness has crippled her. She looked at me and she said, I'm not going to sugarcoat it. I'm having thoughts of killing myself. That made my heart sink. As a society, as a nurse, we should be able to speak ahead and help this patient out. Thank God she was one of the mothers that was able to speak out about it and felt like she could talk about it. But there's mothers out there that don't feel like they can talk about it. I see mothers all the time. I see the way that they have a stare on their face and their eyes start to swell with tears. I'm just asking for you to be more aware of these symptoms, and if you are aware that someone is struggling, feel free to speak to them or try to get them help. Just ask if they're okay. Just be there for them, because you never know. It could be life or death situation, and you could be a person that saves someone's life. Thank you.